This is Indian Country Today.
Esquili, yes, thank you for joining us. I'm Patty Thalohungva. Here are the headlines for Wednesday, October 21st. President Donald Trump releases his plan for Native Americans. The president announced his plan, Putting America's First People First, on Twitter. It lists 5 core principles, including respecting tribal sovereignty, promoting safe communities, building an economy with improved infrastructure, honoring heritage and education, and delivering better health. Among several promises the president outlines, he says he will continue to prioritize the issue of missing and murdered Indigenous peoples. He also lays out his idea to create a thriving economy that will add more than 50,000 Native American-owned businesses. The 3-page plan is on the president's campaign website. He also lists a 10-person Native American advisory board. You can sign up for updates from the Trump campaign by texting 88022. In our coverage of Native Vote 20, Indian Country Today is following the races of 14 Native American candidates running for Congress from both parties. Most are hoping to sit in Congress for the first time, but a few are incumbents running for re-election, like Republican Tom Cole, who is Chickasaw. He assumed office in January 2003 and has been re-elected since then. He is once again running for re-election to the U.S. House to represent Oklahoma's 4th Congressional District, which is a Republican district. Oklahoma is a red state, voting for Trump in 2016 and voting for Romney in 2012. Cole is the former chair of the National Republican Congressional Committee and current vice-ranking member on the Committee on Appropriations. He recently introduced a bipartisan bill to expand civics and history education in schools. Tom Cole is seeking his 10th term against 2 opponents he has beaten previously. The National Archives is scanning more than 300 treaties between the United States and tribes. This is part of a newly completed digitization effort by the U.S. National Archives and the Museum of Indian Arts and Culture in Santa Fe, New Mexico. The online collection features 374 ratified Indian treaties from the archive's holdings. Most of the specially protected treaties are unavailable for use in the Central Research Room because they are so fragile and rare. Several treaties contain drawings, maps, and wampum. Wampum were decorated beads used as currency by some Native American tribes. The public can look at the documents in the Indigenous Digital Archive Treaties Explorer. Just go to digitreaties.org. This digitization project was completed with funding from an anonymous donor. The Navajo Nation is giving $1 million each to the University of Arizona in Tucson and Arizona State University in Tempe, Arizona. This is part of a key effort by the tribe to help researchers combat the coronavirus in the state. With Arizona reporting more than 200,000 cases, the virus is showing no signs of letting up. Donna Autumn Chairman Ned Norris Jr. said his nation is supporting the world-class research that is working to overcome the pandemic in Arizona. The funds come from the Donna Autumn's 12% gaming revenue grant program. This program is a requirement under its state gaming compact to share with local communities. Indian Country Today's newscast will participate in the Facebook Sustainability Accelerator program. 20 news organizations were selected from across the country. Each one is owned and led by people of color. The news organizations will receive an investment and coaching from the Facebook Journalism Project designed to help raise funds and the organization's profile. Sarah Lomax-Reese, president of WURD Radio in Philadelphia and program lead for the program, called this a moment when Black and Brown owned and led media is, quote, absolutely essential to the future of this nation. More than 300 news organizations applied to be a part of the program, and only 20 were selected, including the Lakota Time in Martin, South Dakota. Indian Country Today reached more than 1 million people last month through the Facebook platform. A Piikani man in Alberta is hoping to bring Blackfoot dancing, grass dancing, to a global airwaves. 19-year-old Tariq Crazy Boy has been selected to audition for America's Got Talent. Crazy Boy has been grass dancing since he was 7 years old. He will be performing for the judges virtually on November 14th. He says he's looking forward to sharing his passion with the world.
I dance because it makes me feel so good. I dance because I want to make my people proud. I want to make my community proud.
And those are the headlines from Indian Country today for Wednesday, October 21st. I'm Patty Thalahungva. When we come back, how is the California Rural Indian Health Board dealing with this pandemic? We'll visit with the Director of Research and Public Health. As COVID-19 infection rates in California slow down, tribal nations are seeing an increase. Several outbreaks have cropped up around the state, but right now, Northern California tribal communities are being hit hard. When an outbreak occurs, tribes work with clinics, counties, and tribal epidemiology centers to contain it. Vanesscia Cresci is the director for the Research and Public Health Department for the California Rural Indian Health Board. In her role, she oversees the Tribal Epidemiology Center and joins us now to share more information on how tribal nations are doing and what more can be done to protect tribal citizens in this pandemic. Welcome, Vanesscia.
Hi, thank you for having me. I appreciate it.
Well, tribes are experiencing this rise in cases in California. Why are they experiencing a rise when in other parts of the state COVID-19 cases are slowing down?
Yes, that's a good question. So I think many of these tribal communities are rural and located in parts of the state where there's not a large population of Californians. And so as parts of California are starting to open and starting to allow more types of services, California tribal communities are starting to see an increase in cases. So there are communities surrounding them that are opening up, which will result in cases in their tribal communities.
So tracking this information, you do get data from, actually I think a daily briefing on the data there. Give us a little more information on how that data is collected and how it reflects Indian country.
Yeah, so for California is unique. We are a large state. We have 109 federally recognized tribes. There are 32 tribal health clinics and 10 urban Indian health clinics that provide care to about 725,000 American Indians in California. And so we rely on 3 data sets. So one from the Indian Health Service, that is clinics in California self-report data to the federal government through a portal. The second is from the California Department of Public Health. They publish data on their website. And the third is CDC data that a lot of tribal epidemiology centers have recently gained access to. So from that, we create a weekday, daily situational report that shows the number of positive cases that are occurring in California tribal communities.
And in any situation, data is so important, and then who collects that data, has a lot of power because of the information they have collected. So how important is it to share the data, and how hard has it been to get that data?
Well, it's extremely important because by sharing data, it recognizes the sovereignty of tribal governments that they have. It also recognizes the status that tribal epidemiology centers have as tribal public health authorities under HIPAA. And what that would allow not only tribes, but tribal epidemiology centers allowed to do is be able to better respond to positive cases that are happening in Indian country in California. It also allows California communities to be able to describe how COVID is impacting them. It allows them to share their own story of how this infectious disease has been happening in California tribal communities.
And so from that data right now, what are you seeing in Northern California with tribes there? And give us an idea of the size of population you serve.
So for California, there are approximately 725,000 American Indians. And through the tribal health program system, they serve about 87,000 American Indian active users throughout California. And there are cases that are starting to increase in Northern and Central California, relying on the Indian Health Service data. There are cases that are starting to increase in the North Coast and Cascades. That's where we're seeing a majority of the positive cases. And when you look in urban settings, there are about 260 positive cases in LA County. And 240 in San Bernardino County. And those are counties with a large American Indian population. In California, there are a lot of American Indians that live in urban settings, but like many of us, we tend to travel back home often. And so there is travel back and forth from living in the city and then going back home to visit loved ones. And so many of our tribal community members may seek services both at a tribal health clinic and also maybe in town at the Urban Indian Health Center.
And that's an interesting point you bring up, because as people travel back and forth, there's that concern that the virus is traveling back and forth as well. How are you mapping that? How are you tracking that?
So when partnering with a tribe and they have the authority to contact us if they need assistance with their investigation. So we have been providing technical assistance to tribes and to tribal health clinics as they respond to positive cases in their communities or with outbreaks. And so we can assist them in training the tribe staff or the clinic staff to conduct case investigation and contact tracing. And as we know, this allows the tribe to take ownership of what's happening in their community, and also builds capacity within their tribal community to be able to respond to any outbreaks and positive cases.
And through contact tracing, are you showing tribes how to do that in person? What is the update on contact tracing?
Yeah, so we're doing that virtually. So as we're talking today, we do virtual trainings and assist them. They know their communities best, and their community members trust them. And so they're more likely to be successful if they can be trained to do their own contact tracing and case investigation. So we are here as a resource and provide them with training and assistance and support along the way.
And you're also taking this data and you're creating these maps to show outbreak areas or high-risk areas. Explain a little bit more about how that works.
Yes, so what we've been able to do with tribal approval is that we have created a regional map. So we have divided up the state into about 7 regions, and using Indian Health Service data, we report the number of positive cases by region. And this is allows privacy of the tribes, but also recognizes tribal sovereignty, and that they have sovereignty over their own data and have can make the decision if they choose to release their own data. But we do not publicly report their data. That's their data. What we do is provide the regional map using Indian Health Service data, and then using CDC and CDPH data, we report statewide numbers.
And give us an idea of how many tribes have taken you up on that offer and have shared that data with you.
I don't know the exact number, but I could probably say a handful where we do provide them and have information on numbers, but we don't share that. That is their own data, and we just help them utilize that data to make informed decisions so that they can take care of their tribal community the best way they know how to.
And give us an idea of some of the tribes in Northern California that you're working with right now.
Well, I would say there are a number of tribes that we are working with, and out of respect, I probably shouldn't specify what tribes we are specifically working with, but there are a number of tribes in Northern and Central California that we continually to actively work with. We are open to working with any tribes and clinics who would like our assistance and support.
All right, so what message are you giving to the tribes and even people, Native Americans who live in these urban areas? What message are you giving to them when it comes to shopping for the upcoming holiday season, or even gathering as family members or community members? Because that's we're coming into the season where people are really going to want to get together. So what message are you putting out there?
So we're in the process of developing those messages, actually. I will share that these messages best come from the community. They know their communities best. We have created some COVID educational videos, public service announcements that where the content comes from tribal communities. They are the experts. They know their communities best. We just provide a space for them to share information.
In Inyo and Mono counties, COVID-19 cases are on the rise, especially in people 18 to 49. We need your help to protect our people. Wearing a mask reduces the spread of the virus. I wear my mask for all our tribal communities. Who do you wear a mask for?
I wear a mask for my Hootsie, my aunties, and all our tribal citizens.
Imubi, Iduba, Nu, Nawapoaguti, Inumu.
I wear a mask for my loved ones and my community.
I wear my mask for my mama and Ja'a.
I wear a mask for my Ahim.
I wear my mask for our most vulnerable community members.
I wear my mask for my children, my mother, and my grandmother.
I wear my mask for my niece and nephews.
I wear a mask for my elders.
I wear a mask for Ihutsitsi.
I wear a mask for the preservation of my culture.
I wear my mask for my Paiute Shoshone people.
I wear a mask for our Native youth and our future generations.
I wear my mask for the survival of all Numa people and our future generations.
Remember, wearing a mask helps prevent both symptomatic and asymptomatic carriers from spreading COVID-19 in our communities.
And so those are publicly available on our website, and we do disseminate and share that through social media. It's a variety of videos throughout the state. We're not done. We still have a number of videos to complete. And when it comes to educational content, again, those best come from the community. We just help them develop those messages, and they utilize those in their tribal communities.
All right. Well, one final thought before we go on just the coronavirus pandemic and tribes who are trying to navigate this new world.
Yeah, I think what we're learning, and we're all learning in this together. We're all in this. And I just want to remind that those who work with tribal governments, in particular counties and states, that they are a partner, and they should not forget to partner with their tribal governments. They are sovereign nations. And they have the right to choose what's best for their community, whether it comes to how testing is being conducted, vaccination, educational content. So I encourage partners to reach out and develop those relationships with their tribes.
All right. Well, we want to thank you for being on our program today, Vanesscia Cresci. Thank you so much.
Thank you.
And we'll be right back.
This is Indian Country Today.
Dalton Walker joins us now. He's our national correspondent based in Phoenix, and he just wrote a story about one U.S. representative who is seeking a 10th term in office. Welcome, Dalton.
Bonjour, Patty. Miigwech for having me.
Absolutely. So Tom Cole is the person you wrote about from Oklahoma. Tell us a little bit about his career, and he's seeking a 10th time in office here.
Yeah, I had a chance to talk with U.S. Representative Tom Cole recently as part of our election coverage on our website. As you know, we are less than 2 weeks out from a huge national election, and Cole is on the ballot in Oklahoma, and as you mentioned, is seeking his 10th term and has a really good chance at getting to it. And Oklahoma is an interesting state. And has a rich history when it comes to Native people, and of course, current news events affecting Native people seem to come out of the state often. So it was nice to chat with Chickasaw Nation citizen Cole, even though it wasn't as long as I was hoping, but it was still a nice conversation.
And what are some of the success stories he points to in all of his years in office? Because he started serving he first got elected in 2003 and has been serving continuously since then, being reelected over and over again. Did he share any of his success stories with you as to reasons why voters should put him back into office?
He did. His district has a pretty big military influence, and a lot of his focus to lean with defense and military issues and bringing some of that momentum back to his district. So I think he has a pretty good following regarding that. Of course, his perspective on Native people and Native issues, not only in Oklahoma, but across the country, also plays a role in his success. And it sounds like he isn't slowing down. He's been endorsed by President Trump. As you mentioned, it'll be his 10th straight term if he wins in November. He said he doesn't consider a next term until the early part of the year of the election year, so he didn't give away any clues what he wants to do next. But it doesn't sound like he's ready to move on, or as I mentioned, slow down.
Now, he's a member of the very powerful Appropriations Committee. Did he talk anything about that?
How important that committee is and how glad he's a part of it, and how important, I guess, his voice is and the type of reputation he gets. He stressed that his work across the aisle, our partisan history reflects on that role. And he talked a little bit about the CARES Act and getting that across the line played a role in him just bringing money, that the huge package across, but also stressed the $8 billion that was set aside for tribes, that he had a role in making sure that was there. But yeah, that's probably his most prominent role right now, and it's interesting to follow along as he moved.
Representative Cole recently introduced a bill that had bipartisan support to expand civics and history education in the U.S. schools.
Yeah, he's like I mentioned before, he's always moving forward. Education is part of his strategy, and I know that's important to him, as it is important to a lot of lawmakers. And as I stressed before, that it seems like even though he's a longtime Republican and kind of walks party lines, he's able to reach across the aisle and get people on the same side. A lot of his bills he sponsors.
So Tom Cole there, from the Chickasaw Nation, seeking a 10th term in office. What can you tell us about the opponents that he's running against?
He's facing two others, Democrat and a Libertarian. They both, as you know, have a good shot, but Cole has such a hold on that district that'll be tough for either to overcome. Not saying that he's a shoo-in to win, but just because his reputation, his history, he has a lot of support. He has a lot of backing that he has a great chance. and he was talking a little bit about his campaign through the COVID-19 and what he's been trying to do. But it kind of circles back that he just stresses the things that he was able to accomplish regarding the military, regarding his bipartisan work, and regarding Native people. And he believes that will get him over the top once again.
Wow. So yes, as you mentioned, the election day is just less than 2 weeks away. Early voting has started in many states, and so people are already casting their ballots. What else are you working on between now and the election, Dalton?
Yeah, a lot of election coverage. Another profile on a candidate running for Congress, a tribal measure that deals with enrollment, a few other things. But yeah, it's really heavy on election as we gear up, prep, and see what happens in less than 2 weeks. And it's pretty exciting.
It sure is. Dalton Walker, thank you so much for joining us.
Thank you.
And thank you for watching. Take care of yourselves. Your life is precious. I'm Patty Thalohungva. Join us again tomorrow.
Indian Country Today is recorded at the Phoenix Indian School Visitor Center in Phoenix, Arizona.
This is Indian Country Today.